me, I say that to protect you. And I should mention that if you're not accustomed to taking something, you always want to first check with your doctor, of course, but also move into that gradually, right? Start with the lowest effective dose, the minimal effective dose. And sometimes the minimal effective dose is 0 milligrams. It's nothing. Why do I say that? Well, we already talked about results where they put people's arms into an ice bath in order to evoke adrenaline release. You are welcome to do that if you want. In fact, that's a pretty low cost, zero pharmacology, at least exogenous pharmacology way to approach this whole thing. That's a way of evoking your own natural epinephrine, and it turns out also dopamine release. You could take a cold shower. You could do an ice bath or get into a cold circulating bath. We've done several episodes on the utility of cold for health and performance. You can find those episodes at hubermanlab.com. Also the episode with my colleague at Stanford from the biology department, Dr. Craig Heller. Lots of protocols, in particular in the episode on cold for health and performance, that describe how best to use the cold shower or the ice bath or the circulating cold bath in order to evoke epinephrine and dopamine release. The point is that the time in which you would want to do those protocols is after, ideally immediately after your learning bout, meaning when you're sitting down to learn new information or after trying to learn some new physical skill. Now, whether or not that's compatible with the other reasons you're doing deliberate cold exposure, and whether or not that's compatible with the other things you're doing, that depends on the contour of your lifestyle, your training, your academic goals, your learning goals, etc. But if your specific purpose is to enhance learning and memory, you want to spike adrenaline afterwards. And so what I'm telling you is you can do that with caffeine, you can do that with alpha GPC, you can do that with a combination of caffeine and alpha GPC if you can do that safely. Some of you I know are using other forms of pharmacology. I did a long episode all about ADHD. I have to just really declare my stance very clearly that I am not a fan. I am actually opposed to people using prescription drugs who are not prescribed those drugs, right, in order to enhance alertness. I think there's a big addictive potential. There also is a potential to really disrupt one's own pharmacology around the dopaminergic system. However, some of you I know are prescribed things like Ritalin, Adderall, and modafinil and things of that sort in order to increase alertness and focus. So for those of you that are prescribed those things from a board-certified physician, you're going to have to decide if you're going to take them before trying to learn or after trying to learn. You also have to take into consideration that some of those drugs are very long-acting, some are shorter-acting, and time that according to what you're trying to learn and when. So that's pharmacology. But as I've mentioned, there are the behavioral protocols. You can use cold, and cold is an excellent stimulus because, first of all, it doesn't involve pharmacology. Second of all, you can generally access it at low to zero cost, especially the cold shower approach. And third, you can titrate it. You can start with warmer water. You can make it very, very cold if that's your thing and you're able to tolerate that safely. You can make it moderately cold. How cold should it be in order to evoke adrenaline release? Well, it should be uncomfortably cold, but cold enough that you feel like you really want to get out, but can stay in safely. That's going to evoke adrenaline release. If it quickens your breathing, if it makes you go wide-eyed, that's increasing adrenaline release. In fact, those effects of going wide-eyed and quickening of the breathing and the challenges in thinking clearly, those are the direct effects of adrenaline on your brain and body. And of course, there are other ways to increase adrenaline. You could go out for a hard run. You could do any number of things that would increase adrenaline in your body. Which things you choose is up to you. But from a very clear, solid grounding in research data, we can confidently say that spiking adrenaline after interacting with some material, physical or cognitive material that you're trying to learn, is going to be the best time to spike that adrenaline. Now, I realize that I'm being a bit redundant today, or perhaps a lot redundant, in repeating over and over that the increase in epinephrine should occur either very late in an attempt to learn something or immediately after an attempt to learn something. I also want to emphasize the general contour of pharmacologic effects and of behavioral tools to create adrenaline. What do I mean by that sentence? What I mean is that McGaw and colleagues explored a huge number of different compounds and approaches, everything from the hand into the ice bath to injecting adrenaline to caffeine to drugs that block the effects of adrenaline and caffeine, drugs like mucimol and picrotoxin. Please don't take those. These are drugs that reduce or enhance the amount of adrenaline. And the overall takeaway is that anything that increases adrenaline will increase learning and memory and will reduce the number of repetitions required to learn something, regardless of whether or not that something has an emotional intensity or not, provided that that spike in adrenaline occurs late in the learning or immediately after. And anything that reduces epinephrine and adrenaline will impair learning. And that's the key and novel piece of information that I'm adding now, which is if you're taking beta blockers, for instance, or if you're trying to learn something and it's not evoking much of an emotional response, and you're not using any pharmacology or other methods to enhance adrenaline release after learning that thing, well, you're not going to learn it very well. In fact, McGaugh and Cahill did beautiful experiments in humans looking at how much adrenaline is increased by varying the emotional intensity of different things that they were trying to get people to learn, or by changing the dosage of epinephrine, or by changing the amount of epinephrine blocker that they injected. Lots and lots of studies. The key thing to take away from those studies is that for some people, adrenaline was increased 600 to 700%, so 6 to 7-fold over baseline in the amount of circulating epinephrine or adrenaline. And keep in mind, sometimes that increase was due to the actual thing they were trying to learn being very emotional, positive or negative emotion. And sometimes it was because they were using a pharmacologic approach or the ice bath approach. I don't think they ever used a cold shower approach, but that would have been a very effective one, we can be sure. However, other people had a 0 to 10% increase, so a very small increase in epinephrine. What we can confidently say on the basis of all those data is that the more epinephrine release, the better that people remembered the material. Over and over again, this was shown, whether or not it was for cognitive material, so learning a language, learning a passage of words, learning mathematics, or whether or not it was for physical learning. I want to emphasize something about physical learning because I know a number of you are probably drinking a cup of coffee or having a cup of yerba mate or maybe even an energy drink and taking some alpha GPC or something before physical exercise. I'm not saying that's a bad thing to do or that you wouldn't want to do that, but that's really to increase alertness. It won't enhance learning, at least not as well as doing those things after the physical exercise. Now, again, many of you, including myself, exercise for sake of the physical benefits of that exercise, so cardiovascular, resistance training, but we're not really focused on learning and memory. So I emphasize this just so it's immensely clear to everybody. If you want to use those approaches of increasing adrenaline prior to or during physical training or cognitive work for that matter, be my guest. I think that's perfectly fine, provided that's safe for you. It's only by moving it to late or after the learning that you're really shifting the role of that adrenaline increase to enhancing memory specifically. And as a cautionary note, don't think that you can push this entire system to the extreme over and over again, or chronically, as we say, and get away with it. In other words, you're not going to be able to take a alpha GPC and a double espresso, do your focused bout of work, cognitive or physical work, and then spike adrenaline again afterwards and remember that stuff even better, right? I'm not encouraging you. In fact, I'm discouraging you from chronically increasing adrenaline both during and after a given bout of work if the goal is to learn. Why do I say that? Well, work from McGaugh and Cahill and others has shown that it's not the absolute amount of adrenaline that you release in your brain and body that matters for enhancing memory. It's the amount of adrenaline that you release relative to the amount of adrenaline that was in your system just prior, in particular in the hour or two prior. So again, it's the delta, as we say, it's the difference. So if you're going to chronically increase adrenaline, you're not going to learn as well. The real key is to have adrenaline modestly low, perhaps even just as much as you need in order to be able to focus on something, pay attention to it, and then spike it afterwards. This is immensely important because while much of what we're talking about is actually a form of inducing a neurochemical acute stress, meaning a brief and rapid onset of stress, well, chronic stress, the chronic elevation of epinephrine and cortisol is actually detrimental to learning. And there's an entire category of literature, mainly from the work of the great and sadly the late Bruce McEwen from the Rockefeller University and some of his scientific offspring, like the great Robert Sapolsky, showing that chronic stress, Chronic elevation of epinephrine actually inhibits learning and memory and also can inhibit immune system function, whereas acute, right, sharp increases in adrenaline and cortisol actually can enhance learning and indeed can enhance the immune system. So if you really want to leverage this information, you might consider getting your brain and body into a very calm and yet alert state, so a high attentional state that will allow you to focus on what it is that you're trying to learn. We know focus is vital for encoding information and for triggering neuroplasticity, but remaining calm throughout that time and then afterwards spiking adrenaline and allowing adrenaline to have these incredible effects on reducing the number of repetitions required to learn. So if you're like me, you're learning about this information, this beautiful work of McGaw and Cahill and others, and thinking, wow, I should perhaps consider spiking my adrenaline in one form or another at the tail end or immediately following an attempt to learn something. And yet we are not the first to have this conversation, nor were McGaw and Cahill or any other researchers that I've discussed today the first to start using this technique. In fact, there is a beautiful review that was published just this year, May of 2022, in the journal Neuron, Cell Press Journal, excellent journal, called Mechanisms of Memory Under Stress.